Newborn head to toe assessment. I would begin by reviewing the pertinent history of the mother's prenatal care and labor and delivery care. I would also assess any newborn records that we have thus far. I would review the mother's screening for a history of opioid use. She has none, so that is good. I would review any medications that the infant or newborn has been given. I would review the infant's last set of vital signs and also review any previous intake or output records that the infant has thus far as well. I would verify accurate lighting within the room and temperature. Both are appropriate at this time. There's no draft and the infant is not by a window. I would ensure that infant is in a quiet state before beginning the exam, which he is. I would ask when the infant last ate, ask the parents when the infant last ate. They advised it was about an hour ago, so we shouldn't have any trouble with the baby getting hungry throughout the assessment. I'll take a mental note of that. And I would ask the parents if they have any questions at this point regarding their newborn. Again, they advised they do not have any questions at this point. I would check the patient's care plan, the infant's care plan. I would gather my supplies, wash my hands, put on my gloves, and I would ID the mother with 2 forms of ID, full name and date of birth. And then I would ID the infant as well with 2 armbands and hug tags. And I would just leave the baby swaddled within the crib throughout the assessment, only uncovering the infant when needed for the assessment. Obviously, just to keep the baby warm throughout the assessment here as well, and keep them safe. I would provide privacy, closing the curtain or door, and then I would explain the procedure to the parents as far as what we're going to go through with the newborn assessment, see if they have any questions, and then simply let them know if they do have any questions throughout the assessment to feel free to ask those at any point, and I'd actually encourage them to do so. And from here, I would raise the crib or get to the same level as the infant, just to make my assessment a little easier and for the safety of the infant as well. From here, I would take a good look, just a general appearance of the baby, looking for any abnormalities or signs of jaundice. I don't see any abnormalities there. I would look for symmetry within the baby, and I'd kind of continue to assess this throughout as I take a little closer look throughout the entire body of the baby throughout the assessment. But at this point, no abnormalities with color, symmetry. I would assess the respiratory efforts of the infant. At this point, I do not see any signs of labored breathing. No initial signs of pain that the baby is in, so that is good there. I would assess the position and tone of the baby, just ensuring no abnormalities there. In a newborn, the extremities, they will maintain flexion and tone when the baby is at rest. And the limbs won't just simply be dangling, but more in a flexed position, which is appropriate. I would assess the level of arousal of the infant. At this point, it is appropriate. He's calm. Again, no signs of distress or pain. And I would assess the sleep-wake cycles by simply asking the parents what they've seen there. They've advised that these have been consistent and regular for the infant thus far, so that's a good sign. I would move on assessing the vital signs of the baby. I'd begin by counting the respirations of the baby for 1 full minute. Normal range for a newborn is going to be between 30 and 60 respirations a minute. From here, simply taking a little closer look and assessing that for the baby. I've counted 45 respirations within a minute there, so no abnormalities. And then there could also be short periodic breathing episodes for a newborn. Again, that is regular, normally seen. But mainly I'm looking for any signs, also looking for any signs of distress or apnea, which I do not see at this time. So that's a positive sign for the respiration rates of the infant. I would move on and assess the apical pulse. Normal. apical pulse here. Normal range is going to be between 110 and 160 for the infant. And at this point I counted 130 beats per minute, and that is within the normal range there, so nothing to be concerned about. I would then assess the auxiliary temperature of the infant using the armpit here, and a normal range there is between 97.7 and 99.5. The temperature I received was 98.6 degrees Fahrenheit. Fahrenheit is what I'm talking here. 97.7 to 99.5 degrees Fahrenheit for the normal range. And again, the temperature that I found of the infant was 98.6. So nothing to be concerned about there either. I would move on to a skin assessment of the newborn, looking throughout the body for the vernix, which is present and that is normal at this time. I would assess for any rashes, any birthmarks, any newborn rash. None have been found. Continue kind of looking at these throughout the assessment as I get a little more detailed throughout the body as well. At this point though, nothing abnormal. I would observe the full surface of the baby throughout the assessment as I advised, and kind of just continue to assess everything a little closer as I get a little more detailed here. But upon a quick first assessment throughout the skin, not seeing any abnormalities there. I would take another apical pulse, an auxiliary temperature. Take another auxiliary temperature using the armpit there. Again, normal range is between 97.7 and 99.5. Again, I got the same temperature as before at 98.6 degrees Fahrenheit. From here, I'd move on to an assessment of the infant's head. I would inspect it. I would palpate around. I would also measure the occipital frontal circumference, that is the greatest diameter of the head. And we are looking at about 34 centimeters for this baby here. Normal range is anywhere between 32 and 36.8 centimeters. So again, no abnormalities there, which is good. I would assess the symmetry and range of motion of the head, and no abnormalities seen upon that assessment. And I would also assess the sutures and fontanelles, just gently touching the front and back fontanelle. And I'm feeling nice and soft and flat, so no abnormalities seen there. And throughout the head, I do not see any swelling or feel any swelling, so nothing to worry about there. I'd take a look at the facial features. I would examine the eyes, I would examine the nose, mouth, and ears. Again, for symmetry and just looking for any abnormalities. None seen at this time, so that is positive. I would move on to assess the chest of the infant. Again, just uncovering the infant when absolutely necessary, keeping him as warm as possible throughout for his safety. I would palpate the clavicles, looking, feeling, and looking for symmetry. I would auscultate the lungs. I would auscultate the heart. And then I would, again, no abnormalities heard upon auscultation there, so that's good. And then I would check for capillary refill on the chest, just simply lightly pushing on the chest there and watching for the capillary refill within an appropriate time, and no abnormalities seen there. I would then move on to an abdomen assessment. I would, at this point, auscultate for bowel sounds within all 4 quadrants. See there? And appropriate bowel sounds are heard in all 4 quadrants upon auscultation. No abnormalities seen there. And the parents advise that the newborn has had a bowel movement and has urinated already. So good signs, with everything working correctly within the system there. From here, I would inspect the umbilical cord, and no abnormalities seen upon inspection of the umbilical cord. I would observe the contour and no abnormalities seen there either. From here, I'd move on to assessment of the genitalia of the newborn. Put this down a little so we can see. Keeping the baby warm if I can. And upon assessment of the CBC, I did see a normal range of iron, so no abnormalities, nothing to worry about there. For a normal male, I would check the scrotum for the testes. They are present, and this newborn has been circumcised already, so I would look for any signs or symptoms of any abnormal healing going on with the healing of the circumcision. Nothing seen there as far as any abnormality. Seems to be healing quite well. Again, I don't see any signs of the baby being in any distress or pain either. From here, I would check the anus patency and just note any passage of meconium. No abnormalities seen there. And again, the parents did advise that the newborn has passage of urine already within the first 24 hours here, and that is normal and good, just to show everything is working correctly. From here, I'd move on to a musculoskeletal assessment, keeping the baby warm as I can and safe. And I would note, again, tone and flexion. They are present, no dangling limbs. The baby is able to move all extremities as he's kind of moving around here throughout the assessment, but I would do some active, and I would watch for active and then do some passive movement as well for the newborn, just to make sure everything's moving correctly. No abnormalities seen there. I would palpate the spine, check for sinus, dimple, and tuft of hair. No abnormalities seen there. Probably roll him on his side to get a good look there of the spine. And I would inspect the gluteal fold and leg length as well. And I can get a measurement here of the leg length. And again, no abnormalities seen upon that assessment there. The baby does have 10 fingers, 5 on each hand, 10 toes, 5 on each feet. That is a positive sign there, and the parents told me they've counted those a couple times already, so no abnormalities or anything to worry about there. From here, I would check the brachial pulse of the infant. I would check the femoral pulse of the infant inside the groin here, both sides, just to make sure everything is equal bilaterally on both of those pulses, covering the baby up to keep him warm and safe again. From here, I'd move on to a neurological assessment of the baby. If he did cry at all throughout the assessment, just making sure that's a normal cry, no fluctuations, drastic fluctuations, no extra high-pitched cries. That could be maybe signs of hunger or pain there, but nothing observed, so that is good. At this point, I would change my gloves, wash my hands, put on new gloves, and then I would assess the sucking and root reflex of the baby. I would stick my finger at the side of his mouth, watch for the head to turn towards, and then for the baby to go ahead and latch on and suck on my finger there for a second. No abnormalities seen there, so that's positive. I would assess the palmar grasp and plantar grasp of the infant, and just simply sticking my finger within his palm and then under his toes there as well, and just watching for that to curl around my finger. And that is a positive sign and shows that no abnormalities seen within the reflexes or any neurological problems there. I would then assess the Babinski reflex on the infant. I would use the bottom of his foot and trace from the heel on upwards. And the toes would actually hyperextend and flare out. That is a positive Babinski reflex, and that is exactly what we want to see in a newborn, so that is positive in both ways. From here, I would check the startle reflex. As the baby's in the crib, I'd maybe make sure he's not paying attention, give him a little bump, and watch for the arms and legs to spread and extend, and even arch in the back as well, and that's just a normal startle reflex of a newborn. And then they would simply go back to their normal positioning of that flexed and tone visual, flexed and tone position. From here, I would assess, if the baby has been actually awake throughout most of the assessment here, but as he drifts off to sleep, making sure that he awakens normally as I'm going throughout my assessment, no abnormalities seen there, and then make sure the baby is responsive to touch. Like I said, as he does fall asleep throughout the assessment when I'm not necessarily touching him, as I come back and touch him, he does awake in response to the touch there. So that is positive. So from here, I'd move on just some general information on the assessment. Making sure to, obviously, as I stated, keeping the baby warm throughout the assessment. They can get cold pretty quickly, so only uncovering the baby and keeping him nice and swaddled throughout the assessment when I'm able to. I would making sure to note the measurements of the baby. If I hadn't already, I would take a height measure of the baby just to keep that updated within his chart. Use my measuring tape here again, and just compare that to any previous records there of height. And I would also take the weight of the baby there and update those within the chart as well. From here, again, just assuring that the baby isn't showing any signs of pain, and I would continue that throughout the entire assessment as I did. And I would check, only check for glucose, only do a glucose check if necessary. In this patient, there's no reason to at this point, so we're not going to check that. And I would make sure the baby is redressed, as I did undress the baby for the full assessment here. Making sure to redress the baby and then swaddle him again, just making sure everything's nice and warm, keeping the baby warm and safe throughout. Throughout the assessment, then I would be sure to always keep the safety of the baby in mind, and this would be done just with my demeanor, with my actions, and then also IDing the patient at the beginning of the assessment. And then at the end, I would leave the baby swaddled within the baby's crib, or hand him back to either of the parents if they did want to hold him at this point. From here, I would return if the baby was still in the crib, return the crib to its normal height or low height for the baby's safety. I would assess for any further needs of the baby. And at this point, like I said, no signs of distress, no signs of respiration problems, seems to be breathing fine. So everything seems to be normal there. The parents also see if they have any further needs. At this point, they advised they did not. I would dispose of any disposable PPE that I did wear throughout the assessment. I would clean any equipment that is not disposable, stethoscope, measuring tape, anything of that sort. I would wash my hands and then document all the findings, any observations, and all measurements that were taken throughout the assessment as well. And just document anything and everything that I could think possible, just to keep all the records of the baby up to date, ensuring the baby's safety as assessments and care continue up until discharge. Thank you.